is using the ESTEL trial data and the EEGs specifically that we performed. So what we did was we know that paroxysmal fast activity, or GPFA, it's a core feature of patients that have Lennox-Gastaut syndrome. And what I did was I manually marked up the burden of PFA that each of these patients had on their 24-hour EEGs at each phase of the study. And so what we had was this longitudinal assessment of burden of PFA through each phase. So we could essentially track their seizure diaries with GPFA burden. And when you look at everybody in the trial, it sort of didn't really look like there was much of a correlation between the amount of someone's PFA and their seizure burden. But if you looked at it per patient, you saw that there was this really beautiful trend. So the amount of percentage reduction of their PFA correlated with that percentage reduction in their seizures. And so in a way, we're proposing that for this particular cohort of patients, you can use the amount of PFA on someone's EEG to really see what's happening with their seizures as like a marker, which is it's a neat way of doing things, because we know patients with Lennox-Gastaut syndrome, seizure diaries can be really hard to keep. They often live in group homes. There's rotating carers. A lot of the seizures are more clinically more subtle. They happen in sleep. So to have some sort of an objective measure that doesn't involve somebody writing them down would be really useful, but also for future clinical trials as well, to include that sort of data.